Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about some advice for your first year as a certified medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you have gotten your certification and you are in the process right now of looking for your first job, I've talked about my advice before about looking for jobs and where to apply and that kind of thing. But this episode is more about what you should be doing in this first year while you're looking for a job, and even after you've gotten your first job as a medical coder. This first year is going to set the groundwork for a lot of things in your career. This career is a career. Medical coding, health information, wherever you land, medical billing, this is all a career. And with this, it takes some diligence to know, like, okay, this is the path that I'm on, this is what I have to do to stay here, and this is all the things that I'm going to be working on during this first year. Again, the first year is a lot, but it's not impossible. That's why my channel is here. I have lots of advice about this. But one of the first things that I do want to say is this. If you have a certification in one of the 4 main medical coding certifications, the CCS, which is the gold standard of medical coding credentials, because it says that you have mastered inpatient and outpatient coding. Then there's a CCA, which is a certified coding associate, another fantastic credential. And this says that you have that entry-level understanding of inpatient and outpatient coding. Then you have the CCSP, which means the certified coding specialist physician-based, which means that you know outpatient coding. And these are all with the American Health Information Management Association. Now there's another association, which is the American Academy of Professional Coders, and they have their flagship medical coding certification, which is the CPC, the Certified Professional Coder. This says that you also know outpatient coding. With the CPC, if you do not have any experience in coding, and you're within your first 2 years, you're going to have an apprentice status attached to the CPC. Now, you can accelerate the removal of the apprentice status so that you don't have to carry it around for 2 whole years by going through one of their approved programs, or you can take Practicode as well, and that will also help accelerate the removal. If you don't go through one of their programs and you just take Practicode, it can take 1 year of work experience off, because according to AAPC, what you work on in Practicode is what the equivalent of what 1 year work experience would be, you know, if you're in the real world. However, this does not count as work experience. So don't even try to fake it on your resume, because people know what Practicode is, okay? And they know that it is not considered work experience at all. It's not even an internship, guys. This is just an educational tool, okay? So if you have one of these 4 credentials, that is all you need to start with. You just need one. There are schools out there that will push and push and push and push for you to get multiple credentials, and oh, you need to be certified through both associations. You do not. That is a lie. When you're looking at the job ads for medical coders, it will say candidate must have ba 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 ba, or. You know, it never says must have this credential and this credential. Why? Because some of these are going to overlap. For those of you that have the CPCA and the CCS, which makes no sense, but this says that with the CCS, again, you understand inpatient and outpatient coding, and the CPC just says you know outpatient coding. So again, all you need is one. You just need one of these 4, all right? You do not need more than one. And if you are certified through another association, which I will not mention here because I do not believe in their certifications, if I did not call your certification, that means I do not recommend it, okay? Now, there are other ones out there, like I say, that I don't recommend, because why? Employers are typically not looking for those credentials to begin with, okay? There are some schools that promote their programs for medical billing and coding, and that's what they will promote is, oh, this credential, and no one asks for it. Guys, you have to learn to do your research, okay? All you need is one of these 4 I said, the CCS, the CCA, the CCSP, or the CPC. Now, wherever you decide to go in one of these 4 is totally fine. All right, it is totally fine. Now, a lot of people will start off in their careers on the outpatient side, and which is fine. I have been in the outpatient setting myself for 16 years. And for 13 of those 16 years, I had the CCA. The CCA that says, yes, you have entry-level competence. Why did I hang on to it for so long? Because I wanted to prove a point. There's a lot of ignorance out there when it comes to the CCA, and it's upsetting to me because people say, oh, that's an apprentice. No, it's not an apprentice. It stands for Certified Coding Associate, okay? And if you hear people saying, oh, it's an apprentice, they clearly don't know. Don't listen to those people, all right? But it just says entry level, that you understand inpatient and outpatient coding. This is a very difficult exam to pass. So I'm gonna leave that one right there. But my advice to you guys in the first year is to only have one certification. I get messages all the time, and even more so here recently, for people who say, well, Blue, I got my CPCA. Which credential should I get next? You need to slow down. And in the first 2 years, you should only have one certification because you have a 2-year reporting period for your continuing education units, okay? So if you are with the American Health Information Management Association or the American Academy of Professional Coders, they both have a 2-year reporting period on a certification, okay? So you have 2 years to report your continuing education units. And in the instance of AAPC, you have to pay your membership dues every single year. AHIMA does not have this requirement, okay? You can be a member if you want to. However, if you choose not to be a member of AHIMA, they will charge you separately to report your continuing education units, so that way you can keep your credential current, all right? You have to report those. With AHIMA, for any of the coding certifications, the CCS, CCA, or CCSP, they want you to have 20 for just one, okay? But if you're with AAPC, the CEU count on one credential is 36. Okay, it is 36 for just one with AAPC. And when people ask me, well, what credential should I add on after this? Which one should I go for next? Guys, the thing that you need to be concentrating on in the first year is building your knowledge, not a bunch of credentials. Because if I'm a hiring manager and I see somebody that has no experience and they have a string of credentials on their name, I'm not hiring that person. I'm not. Why? Because what are you telling me? That you're taking a bunch of tests and you're spending a lot of money and you're just passing a bunch of tests. These tests that are multiple choice, okay? They are multiple choice. So with that said, this is the thing that you have to understand. When it comes to representing yourself and your knowledge in getting into this industry, they want you to be able to pass an assessment test. And a lot of people who have multiple credentials cannot pass an assessment test when they are starting in their first year. So this is why I say you only need to have one. And if you look at the job listings, it also says there, must have CCS, CCA, CCSP, or CPC. Sometimes they say must be certified with AAPC or AHIMA. One of the two. They don't care which credential that you have. They just need to know that you can pass their assessment test. That's what you should be focused on. Not racking up a bunch of credentials, especially in your first year. I've had a lot of sad stories come on to my inbox and where people say, well, Blue, I have 4 credentials. I don't have a job. I'm looking for a job. Can't find one because my teacher said that I needed to have all these 4 credentials. Now, why would somebody do that to somebody and taking advantage of their being naive and things like that, getting into this industry? I don't know. To me, that's just wrong. It's unethical. It's disgusting, in my opinion. So if you're getting pressure to get all of these credentials, you need to stand up for yourself and say no. And you need to show a job listing that says you just need one of these 4 credentials. That's it. Now, I'm not speaking to my degree holders. My degree holders, yes, I do agree that you should also get a medical coding certification. Only because my degree holders, the ones that hold the RHIT, the Registered Health Information Technician, or the RHIA, the Registered Health Information Administrator, these are for our leaders. The concentration of these programs is about the law. It is about HR activities. It is about data collection. It is about statistics. That is their main push in those degree programs. It is not the medical coding. The medical coding portion is actually almost an afterthought. So do I recommend that they get a medical coding certification? They just need one? Absolutely. Absolutely. And having two in the first year, it's only because, you know, you have a degree, okay? And maybe you didn't know about getting a medical coding certification. But having a degree does not mean that you know automatically about anything about coding. I know many degree holders that have no clue about coding because their position or the reason that they got that degree designation was to get into leadership. And they let somebody else, they delegate that to somebody else to take care of. Do I think that that's right? Absolutely not. Because I think even in the leadership position, you should know what your people are supposed to be doing. And just because you don't do it doesn't mean that you can't have the knowledge. Okay? That's how departments fall apart, is when people at the top don't know what the workers are supposed to be doing. I'm just saying. So with that said, that is what I would have to say. Don't write me asking me which credential you should get next, because I'm not going to answer you guys. I don't answer those questions anymore because there's plenty of shows on my channel that say you don't need an additional credential. I don't care who says what. All you need is one, just one. And you need to be working on your practice workbooks. You need to be working on your medical terminology and your anatomy. I don't want to hear that you don't like medical terminology and anatomy. That's 100% of what we have to work with every single day. Okay. The next thing is in the first year, you don't work for free. A lot of people say, well, you know, I'm willing to work for free. I just want to do an internship somewhere. Guys, working for free really is not allowed in this industry. Why? Because if you are working for free and there's no sort of arrangement and contract already in place, because the schools will often be the ones that are with the internship, right, for the degree holders. This is something different. There is contracts in place for those types of things. There's a lot of legal work that goes into that and setting that stuff up on that side. But if you are just saying, hey, I want to work for free because I'm a brand new coder and I just want to volunteer somewhere so I can get experience, your skills that you have worked to get, your certification that you had to pay for, or the program that you were in paid for it, either way, you have a valuable skill. This is not something that you should ever give away for free. Because if you're sitting here crying and going on that you want to work for free somewhere, this dilutes the market for everybody else, number one. Number two, when you are doing that and somebody lets you in, what makes you think that they're going to hire you? If they have somebody working for free, why should they hire you? You're willing to give away your skill for free. And I've had one lady say, well, Blue, I volunteered and I volunteered in that she was a secretary and she was working and they were letting her do the coding side. So she was doing two hats in one. And then because she was telling them, hey, I want to be a coder. Do you think they ever hired her as a coder? Absolutely not. Absolutely not. They had everything with her being a secretary and they just strung her along. So don't get caught up into that. When I hear those types of stories, I don't know what people are thinking, because just because they let you work for free, which they shouldn't, again, because unless you have some type of contract in place, you run around back there willy-nilly is a HIPAA violation. But you should never work for free because you have a skill that took time to build and learn and things like that. And this is a multi-billion-dollar industry, healthcare is. And to work for free is ridiculous. To set yourself up for working for free is also ridiculous. Because again, if you don't demand a payment for your services, what are you doing? Because they're getting paid and they're getting paid off of your knowledge. Okay. And I understand, like in the beginning, you're trying to learn and you're still in the process of learning, but it doesn't mean that you should be working for free. It doesn't mean that employers should try to take advantage of you because you don't know any better and you don't believe in yourself. Okay. So you never work for free. And don't complain that you couldn't get an internship. That's why you can't get a job. No, you can get a job. There are coding adjacent. Somebody asked me that a few days ago, but yes, there are coding adjacent positions. I've always talked about medical billing. If you can't get into medical coding, get into medical billing, just something to, get your feet on the ground, boots on the ground. You can be working and, doing something so that way you can get that exposure to the codes. And being a biller is also going to use your coding skills that you learned. Obviously, you're going to know if there's a denial. Maybe you can see that there's supposed to be a modifier there before you submit the claim, that kind of thing. So there's a lot of things that could benefit somebody for just starting into coding to start with the billing. Okay, you don't have to stay there forever. As quickly as you were able to get that job, you can certainly get another job as well. And you can move on after that. But there's also a claim reviewer if you're working for the dark side, the insurance company. If you work for the insurance company like Blue Cross Blue Shield or Aetna, and you're reviewing the claim, so there's two kinds of claim reviewers. There's one because they want to see if it's actually a legitimate claim for service, or there's the other one that's processing the claims. So the provider sends the claim in to the insurance company, and they're the ones that process the checks. So they're running the codes that are selected through a encoder, and the encoder is saying if there's any edits here. If there's edits, then you deny the claim. That's what I'm talking about for my new people, okay? And you having a certification in medical coding, again, you're bringing all that knowledge in to this insurance company, and they can say, okay, yes, well, this one should have had a modifier, and then you can kick it back, and deny it. So there's that kind of position. There's prior authorizations. Prior authorizations is also not coding. However, prior authorizations is looking at documentation, and the doctor saying that the patient has this condition and they want to perform this procedure. Call the insurance company and see if they can approve this. And so again, you're getting that exposure to the electronic health record. You're getting exposure to the notes and to the codes and things like that. So that way you can start to understand without having that pressure of having to code right out of the gate. Because I know that there are some people that are kind of nervous about that. They feel like they learned really quickly and then they got their certification. They were just lucky enough that they just passed. And so they're just kind of concerned about their own coding skill. So if that's you and you want to do something like prior authorizations, again, that's getting your foot in the door and that's using your skill. You don't want to get into, have your foot in the door by being a secretary. Because again, as I've said, if they like you in the secretary position, you're going to stay there. If you are applying for a referral coordinator, again, if they like you there, you will stay there. You will not move. And anybody who disagrees with me, please, okay, have several seats. Have several seats. Because again, I've had people who write to me and tell me these horror stories where they say that they were really good at their position and they were not allowed to move on. HR did not help them. They were there at that job for 4 years and they actually had to leave that organization in order to advance in their coding career because they were insisting on keeping that person in that department, in that section, because that's where the company needed them to be. Not anything about benefiting that employee and their growth. It was about the company's needs, not your needs. So y'all keep that in mind. And, I know what I'm telling you guys. And a lot of you will still argue with me. I don't know why, but whatever. I'm just telling you so that you're not caught up in these situations that is unnecessary to be caught up in. Okay. The other thing that you should do in the first year is do network. Because when it comes to this, everybody's talking the same language. A lot of people still struggle to understand some things that you may understand, and you may not understand some things that other people understand and can explain to you a little bit easier. That's the benefit of networking. That is the benefit of getting to know the industry and the people in the industry. Now, of course, you can sign up for social media like LinkedIn. LinkedIn is a great place to meet other coders and to be able to network. And sometimes it's your network connections that will help you to get more educational opportunities, and sometimes you can get job leads that way. Although I would not rely on job connections or connections through LinkedIn for a job. Okay, I've seen plenty of those, and a lot of times people don't even respond to those. Like, oh, I'm brand new and I'm looking for work, and if you know of any jobs, usually I see no comments on those types of posts. Or you'll see somebody trying to scam that person, you know, because they'll send them messages through like the inbox and things. And I don't believe in that. That really upsets me so badly, because I don't like when people take advantage of people, especially when they're at their most vulnerable, when they're trying to look for a job. And then you have people out there who have the audacity to, sorry, I'm from Texas. I say things with a little bit of an accent sometimes, but when I see people that they try to take advantage of them through the messages and they don't know any better and they just respond and go through all these things, it just makes me so mad, because again, it's unnecessary. It's unnecessary. And what are you doing with your life that you have time to be trying to scam folks? It's just stupid. It's just stupid. I'm just saying, you know, but do network. You know, those network connections are very important. I've had people who have networked with me, you know, before, but some of them I have removed that connection, because if it sounds like it's just like what is it? A sales pitch, you know? I've had those where it's just like a sales pitch. I get rid of those people, because it's just like, because they want to build a network. But they do it in a sales pitchy type of way. And so it doesn't feel like a genuine connection. It just feels like, hey, I need your skill for this because I'm a business owner and I do this kind of thing. No. That's not a genuine connection at all to me. And so I always remove those types of connections, because you can see the type of person that it is, you know. And so I will do that, and I will remove others that are connected with them, because it's just a fake connection. And I don't do fake connections. Whenever I do make connections with folks, whether it's that I meet them in person at a conference, or, you know, I'm at a webinar and we just kind of meet and talk and things like that, because I've connected with people through webinars as well. They will message me after the webinar and would be like, I didn't know that you were going to be here. And so they were like, and they tell me, only because of the show, they know me by the show. And who else has a name Blue? Nobody, you know, at least not in this field anyway. So that being said, networking is very important in your first year. Getting involved with the organizations, whether it's the American Health Information Management Association or the American Academy of Professional Coders, is great. Okay, it is great. There's a lot of like those networking meetings and things like that. And it's a great place to get to know people. And sometimes if you have to sit back and observe the first few meetings and just kind of figure out who's who in this room and just kind of build from there, don't make it like you're so desperate, but just make it where these are genuine connections. Because no one wants to feel used, guys. No one wants to feel like, oh, you're only connecting with me because of my connections this way. You know, you always want to be as genuine as you possibly can. Again, because no one likes a user. Just saying. The other advice that I would have in your first year is only apply for the places that you want to work. It doesn't make sense to indiscriminately apply everywhere. Because if you're indiscriminately applying everywhere, you know, that organization is going to know, because your resume may look generic, or your cover letter may sound generic as well. And you don't want to do that, because then you're just wasting time. You need to be deliberate with where you're applying. And again, looking at the job listings and changing the job titles, because sometimes medical coders are not always known as medical coders. They're known as coders, coder 1, coder 2, coder 3. Some of them are known as medical records technicians, health information specialists, that kind of thing. So they do change the job titles for medical coders, and they may be called different things at that facility. But then again, it goes to your research and your research abilities to be able to look at the job listing and see what it's asking for. Okay, it starts talking about coding, then you know. Sometimes it's revenue cycle specialist, revenue cycle technician. It's weird. I would think more that revenue cycle would be for the billing rather than the coding, but I've seen it both ways, that they're referring to coders. So it's like, okay. But you only want to apply for the places that you really do want to work. Okay, guys, there's no sense in applying for something that you don't want to do. All right. If you want to apply for like an HCC or risk adjustment job and you only want to make that a short stay, I recommend that, because HCC coding or risk adjustment coding is just diagnosis coding only. You really do need to be strong with pathophysiology, and a lot of people don't know that because they get so excited that it's just diagnosis coding. But again, guys, when you're applying for these jobs, there's other people that are looking for jobs too. And so if you're putting your resume out there for something that you really don't want, and then you get called for this position and you're like, nah, I don't really want that, and then you make that person wait, that's not right. So that's just what I would say there. Only apply for the positions that you want, and when you're applying to these positions, make it deliberate, okay? Make sure that you update your resume to the job title and somewhere in your resume. And the same thing for your cover letter. You need to be updating this every single time. For those of you who cry and whine that, oh, I don't want to have to do that every single time. Well, do you ever want to get a job? Because that's what it's going to require. Okay? I'm just being straight with you. And finally, do study the specialty that you want to work in. Okay? So if you have found a job, let's just say you found a job at an OBGYN clinic as a coder, and you're very excited. You need to be pouring into those books, even after you've gotten your job, so that you can sharpen your skills on OBGYN coding, right? Mother, baby. You need to be working on that. Same thing if you got a job at a pediatric clinic. You need to be pouring into those pediatric chapters. You need to be looking at the websites that are devoted to pediatric medicine. Same thing with OBGYN. Same thing for ortho or for neuro or for cardio or for any of those. Emergency department. You're going to be looking at everything, okay? But if you know that when you're in this position, hey, I really struggle with injury coding, then you know you need to be looking at injuries in the coding book. You also need to be looking up the musculoskeletal system also in the coding book as well, and looking at the common procedures, you know, that kind of thing. That's what will help you to advance in your first year. Not just because, oh, I didn't learn and my teacher didn't teach me and it was a fast program. No one picked the fast program but you. That's a fact. No one picked it but you. Sometimes it's a circumstance. And I get it. But guess what, guys? We also have the ability to be able to take back control, which means that even though you got into this fast-paced medical coding program, you can still study on your own. You don't have to have permission from the school to study, right? So with that said, again, now we're taking back control. And so everything that happens to us, we don't have to be a victim of circumstance. We can say, you know what, this was the situation where I went through a fast-paced medical coding program. I had a terrible teacher who didn't want to be there. They got upset with me when I try to ask questions. I'm just saying, guys, this is an example, okay? Don't freak out. Not everybody has this type of teacher, but there are some people that do. And especially with these fast-paced medical coding schools, they're notorious for this, okay? And then you say, well, you know what? I said, I'm not going to not get this. I'm going to do everything I can to try to understand this myself. And whether it is going through my independent study, getting the books that I recommend, it's all in the description box below. Every single thing that I tell you guys that I recommend is in the description box below, and I'll still get the question. I'll still get the question in the comments. But guys, look at the description box. Go through that independent study and get those workbooks so that way you can start to build your skill. You can build your skill on your own. This is something that can be learned by yourself. But if you do get stuck and you do say, well, I need help understanding this, you can get on LinkedIn. You can post your question on LinkedIn. Not complaining, not crying about, oh, how it's unfair, but just asking a straight question of like, okay, what about this situation? What do we do here? You'll see that will provoke a lot of conversation, okay? And then again, if you say, well, there was too many variety in this situation here, you need to thank the people who did respond to you, because there's some people who are ungrateful and who don't respond, in which I don't like that. If you ask me a question and I respond to you, I take the time to respond to you, you better come back and say, thank you for taking the time to respond. Believe it or not, when people don't do that, I remember those things myself. Do I want to help you the next time you get stuck on a question? Nope, I want to help you. Because you did not exercise a good communication skill, which is thanking the person. Again, when you do that on LinkedIn and somebody responds to you, you need to say thank you. You need to at least acknowledge what they had to say. And if you, like I say, if you need to hire somebody to help you as a tutor, that's what you need to do. Okay. Sometimes we need to put a little bit more investment into ourselves, and whether it is, working through more workbooks or looking online at different videos or hiring us a really good tutor. And you got to be careful out there, guys, because I've seen some tutors, they have less than 2 years of experience and they're out there saying, hey, I'm a tutor. What do you know? You have less than 2 years of experience. What do you know? You need to have time in when it comes to teaching other people. You may be very knowledgeable, but there are some things, because you're so new, that may still not make sense to you, and you're trying to sell your services and be out there for other people. You need to make sure that you understand, because it's unfair to people to do that to them. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. But guys, just know that when it's your first year, there's a lot going on. You can take it as slow or as fast as you want to, but don't overburden yourself with needing to get all these credentials, because you don't need it. You just need just one in the first 2 years. After 2 years, then absolutely. You start seeing the different things that you want to do. You start seeing that the other credential doesn't overlap, then you're fine. But again, guys, in the first year, you need to concentrate on sharpening your skills as a coder first before you go and do anything else. That's my advice anyway. And now with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.